Hello, everyone. So, what is joint modeling? Well, it's exactly what it sounds like. Well, not quite. It's not like your elbow or anything. A joint model combines two models, a longitudinal model of repeat measures, such as a linear mixed effects model, and a survival model. This is also known as a time to event model, and such as a Cox proportionate hazards model. And it joins them through an association structure, usually using shared random effects, and it creates a joint model. Joint model, two models joined together. So why should we use joint models? Well, that is an excellent question. So thank you very much for asking. It reduces bias, it improves efficiency, it allows for repeat measures. Other benefits may include, but are not limited to, accounts for measurement error, and allows for uneven spacing of repeat measures, i.e. different follow-up times for different patients. Why might we not want to use joint models? Well, they're more complex computationally than traditional models. As a result, they can be harder and a little more problematic to fit. They also take longer to fit, and currently they're just not as well known as traditional models. But, this is a presentation about heart failure. What about joint models in heart failure? Well, my research, I'm interested in biomarkers, specifically biomarkers related to heart failure, such as natriuretic peptides, NT-proBNP. These are produced in response to an increased wall tension in the heart and are well established within heart failure as a key biomarker. My goal is to improve current prognostication by creating better, more efficient models using data from randomized controlled trials within heart failure. One of my planned outputs of my PhD is an R-Shiny app. That's an interactive web application allowing for real-time prognostication by clinicians to aid in heart failure management. Ideally, the clinician would be able to input the patient's baseline and repeat measures and see how changes to these would change the prognosis of the patient. An example of this, maybe they want to change the drugs they were prescribed or update the biomarker measurement and seeing whether this change would improve their survival probability, decrease it, or have no effect on it at all. So this is my presentation on joint modeling in heart failure. Thank you.